Thank you. My name is Ann Meier, and I'm along with Kamp Dush from the University of Minnesota. We're going to tag team our presentation, so you'll get a short dose of each of us this morning. I wanted to thank the consortium for supporting our work. We found this meeting very generative, and we're excited for the rest of the day as well. We'll be presenting findings on stress and mental health during COVID using the National Couples Health and Time Study, which Claire is a PI on and was collected during the beginnings of COVID. This is our team. We have a great team at Minnesota and some others from other institutions as well. The two papers we're presenting today include this team, but there are more folks that are with us as well. I'm going to present the first study here today and then hand off to Claire. The first study examined how healthcare discrimination is associated with COVID-19 parenting stress for parents who are marginalized by race, gender, or sexual identity. And in terms of stress, so far, of course, we've been talking about COVID, but there were two kind of cataclysmic events happening in the second half of 2020, COVID and the acute racial trauma and reckoning spurred by the killing of George Floyd in our hometown in Minneapolis. And so some of you might be familiar with the work of one of our colleagues at the University of Minnesota with a fun name, Elizabeth Wrigley Field. She's demonstrated that even in the extreme pandemic mortality, white mortality didn't come even close to the levels of Black mortality in non-pandemic years. So the summer and fall of 2020 was a period of acute racial trauma amidst a chronic condition of racism. So the paper Claire will describe tackles that intense period. The paper I will describe just focuses on COVID stress, but we wanted to recognize that in reality, in people's lives who are filling out surveys and from whom we are collecting data during this time, there were more things happening. And these were two big things that were happening in our country. So first, on COVID-related parenting stress, the research we proposed in our U01 application argued that disparate mental health outcomes by race or gender or sexual identity were not due to the identities themselves, their race, their gender, or their sexual identity. Rather, they were due to the marginalizing social institutions and processes of racism, sexism, and cis-heterosexism. Our first paper takes a bite-sized attempt at the conceptual model I just showed. I think I went too fast. We ask, how are stress levels different for those of different race, gender, and sexual identities? And how can we better understand that by capturing their experiences of racism, sexism, and cis-heterosexism? So we are using those, to understand those experiences, we are using a measure of healthcare discrimination. So we use the NCHAT data, the National Couples Health and Time Study data that was gathered in late summer of 2020 through spring 2021. This is a population representative sample of couples. For all our analysis in this paper, we selected those main respondents who are parents with children under 18 in the household. There are over 1,000 of those in the data. The identities that we assess are race, gender, and sexual identity. For race, we use somewhat standard categories, identifying Hispanic ethnicity and then non-Hispanic white, Black, Asian and Pacific Islander, American Indian, Alaskan Native, and another or other race. For gender, respondents reported their gender identity from 5 options, including woman, man, trans woman, trans man, and some other gender, which would include things like non-binary or gender fluid. We coded gender into 3 categories: man, woman, or another gender identity. We include respondents who report as transgender in the gender that they identify on the survey. For example, trans men were included with men, trans women with women. For sexual identity, we coded respondents into 4 mutually exclusive categories, although there were more in the survey. These categories that we use are gay or lesbian, bisexual, heterosexual or straight, and another sexual identity or multiple identities. For marginalizing processes relevant to the health event of COVID, we create a measure of healthcare discrimination. This comes from 5 items. The scale that we create for healthcare discrimination is from the prompt, when seeking healthcare, and these 5 items, worry about being negatively judged, worry that my diagnoses will be negatively affected by who I am, worry that I might confirm negative stereotypes about people like me, can trust that I'll get high quality care, that's reverse coded, and think that healthcare providers don't take my concerns seriously. Response options range from 1, strongly disagree, to 5, strongly agree, and we averaged the scores for a range of 1 to 5. For our outcome variable of COVID-19 parenting stress, ultimately we created a latent variable from 3 indicators. All items began, how stressed are you about the following? And all response options range from 1, not at all stressed, to 5, very stressed. The first is, how stressed are you about my children getting COVID? The second is my children's education during COVID. And the third is healthcare and health insurance during COVID. So some descriptive statistics here. The bar chart on the left shows, I'll discuss the blue and red bars together because they're quite similar. The blue bar is how stressed are you about your child getting COVID, and the red is how stressed are you about your child's education during COVID. So parents of another race had the highest levels of stress, followed by Black parents and Hispanic or Latina parents, which were significantly higher than white parents. Parents of another gender had the highest levels of stress, followed by women, which were significantly higher than stress levels reported by men. And gay and lesbian parents had the highest stress, closely followed by parents with another or multiple sexual identities, and bisexual parents, which were significantly higher than the stress among heterosexual parents. The green bar is how stressed were you about concerns about healthcare and insurance during COVID. And here again, parents of another race had the highest levels of stress, but across other race and ethnicities, stress levels related to healthcare and insurance during COVID were similar. For gender, parents of another gender had the highest levels of stress, followed by women, which were both higher than stress reported by men. And by sexual identity, bisexual parents had the highest stress, followed by parents with another or multiple sexual identities, which were higher than heterosexual parents. So in all of these cases, marginalized populations reported significantly higher stress than white male heterosexual parents. So we use these to create the latent variable COVID-19 parenting stress. We use structural equation modeling to assess the degree to which differences in COVID parenting stress by race, for example, operated through racism, measured by experienced healthcare discrimination. Indeed, we find that most identities on the left here link to COVID parenting stress through healthcare discrimination. So you can see the green lines indicating indirect effects through that middle variable of healthcare discrimination. The indirect effects between Black race, AAPI, Asian Pacific Islander, bisexual identity, another sexual identity, woman, and non-binary gender identity, and COVID-19 parenting stress through healthcare discrimination were significant. Among all marginalized identity groups that we assessed, only for women did a direct effect from gender identity to COVID parenting stress remain, in addition to its indirect effect. The pattern of indirect effects through healthcare discrimination supports our approach of including a measure of discrimination rather than relying on individual identity indicators, which can leave open to interpretation the true source of health disadvantage. And I think I'm going to toss it to Claire for the second paper.
So I want to recognize my graduate student, Sierra Clark, who led this work as part of her RA-ship with us. So Americans racialized as Black are chronically exposed to social situations that can devalue, demean, and disadvantage them as a result of structural racism. And stress from marginalization can be experienced at both the individual and couple levels. And as Anne highlighted, post-George Floyd's murder and the COVID-19 context was particularly stressful for Black Americans for the grief associated with the higher rates of death among Black Americans, as well as the trauma of George Floyd's murder and all of the experiences that went along with that. So we wanted to look at just our Black respondents. There's a lot of research documenting disparities between white, Black, and other races, but we wanted to look just within our Black couples themselves. And we had 90 dyads. So not everybody in our study has a partner that participated, but here we're using just the partners. Thank you. And so we're looking at 90 Black same race couples, and then we have 87 interracial couples that have one Black partner, and all of them we're focusing here on the different gender couples. For the measures, we have this measure, this question that I worked on with my colleague Rachel Hardiman around the time of that we were going in the field, and it was, how has the recent movement for racial equity sparked by the killing of George Floyd influenced your stress? We also use the everyday discrimination scale. And then when we're talking about the common data elements, one thing I thought of is this is a kind of a nice measure that we have. It's called perceived community climate. And we asked this question for 5 different identities. And the question is the city or area where you live a good place or not a good place to live for racial and ethnic minorities? We have similar questions for other identities. So if you're looking for something to kind of capture the experience of place, I like that measure a lot. And then we're using the CESD. We have a measure of anxiety symptoms from the general anxiety disorder scale. And then we also have a measure of structural racism. So we created a latent variable of structural racism following Chanterat et al. 2022. And here we're using the data from the IPM's contextual determinants of health. And using our UO1 funds, we created this new IPM's, I guess it'd be a new product. And here we're using 3 of the county level indicators that we have. And by the way, you can go online and download all these data for free from the IPM CDOH. And there's 5 indicators for each county. 3 of them fit on our measure that we're using here for this sample: education equality between Black and white, employment inequality between Black, white, and homeownership inequality between Black, white. On the IPM CDOH, you can also download the same disparities for every county in the US for Latine white and for Asian white. And I just wanted to point out that there was a lot of, discrimination happening for Asian Americans and racial trauma as well during the pandemic. And I'm not talking about that's part of our sample today, but I just wanted to mention that. Anyway, this is a measure that these 3 different county indicators loaded on the structural racism measure. So these are, they're called actor-partner interdependence models, which is where you are using couple data to look at how couples impact each other, or in this case, there wasn't a lot of impacts across couples. And so what you can see here is, first of all, one of the coolest findings, I think, in this study is that the structural racism measure, which seems kind of distal, and it's this measure of disparity and those 3 indicators I just told you, and it comes from census data. Or I think from the ACS, and it's kind of distal, but it was associated with our respondents' reports of how good their community was for people that are racial and ethnic minorities. So I think it's another level of maybe some additional indicator of validity of these measures of structural racism, which has been debated about what are these really capturing these disparity measures. So it was associated with our measures, though we did not find that it was associated with depressive or anxious symptoms in our sample. But we did find that reports of discrimination was associated with both racial trauma stress and each individual's depression, but we didn't see any women's impacting or associating, I should say, because these are all collected at the same point, associating with men's or men's associating with women's. We didn't see any of those couple or partner effects, as they're called. For anxiety, we did see that when women reported that their community was a more negative place for people that are racial and ethnic minority, when Black women reported that, men had higher levels of anxiety. So we did see a cross effect there. Thank you, Megan. When we were looking at our interracial couples, because of limits in terms of degrees of freedom, because these measures take a lot of data and degrees of freedom, we found we didn't look at that structural racism measure, but we did find that non-Black partners' perceived community climate was associated with their Black partners' racial trauma stress, and the Black partners' perceived community climate was also associated with their racial trauma stress. And then we found mostly just actor effects for the remaining. And then when we were looking at for the Black part, again, we find a similar pattern for anxiety with a few effects that were related to gender. So I have less than a minute left, so I'm just going to go to the key findings. And talked about some of the key findings for that study. The key findings for our study was that the mental health of people racialized as Black was significantly shaped by their experiences of discrimination and the murder of George Floyd during COVID-19. And we think that this is something that we need to talk more about as we're considering the impacts of COVID and the grief that was associated with losing more family members for that group. And we also found, of course, that COVID was stressful for parents from marginalized backgrounds more than non-marginalized parents. And so we need to consider these things as we move forward and thinking about the impacts. And thank you to our funders.